Doctor, are you aware, I know your lab at Good Samaritan did not do this process, but are you aware through your training and experience of any sort of mathematical conversion that can be done from a serum reading in milligram per deciliter to a blood alcohol concentration in whole blood?
Objection, Your Honor.
I'm going to allow it. The door was open.
Go ahead, sir.
Yes, I am aware. Yep.
And please describe what you're aware of with reference to that.
Well, with blood alcohol concentrates goes to, when it's in your blood, it goes more to the watery components of your blood. So when I described the process earlier, whole blood is before we spin it. And when we test the plasma, which is specifically testing the watery component. Now, people have done studies like how much percentage of water is a serum versus whole blood. Basically, to put it simple, there's a higher percentage of water in the serum versus whole blood. So a hospital result will always be a little bit higher than a test on whole blood. It can be, I think the ratio, the conversion factor is anywhere from 1.1 to 1.18. It's always could be 18% or 11% higher in serum versus whole blood. But we don't do it. That's what I read. I will defer that to the experts.
Now, Doctor, you were referencing in your cross-examination about a study that you were aware of about 10 years ago or so regarding MS and alcohol testing. Is that correct?
It was more on MS, looking at the results of lactic acid and LDH to see how high the levels of lactic acid can go in a group of multiple sclerosis patients. When reviewing that, we found that the range went from some normal range. 16% of the multiple sclerosis patients had normal lactic acids, but the remainder had elevated levels. But those levels were not anywhere near the required levels to produce a false positive. Our package inserts and for the Roche testing system, the Roche has it's an FDA-approved test, and they have to do in-depth, detailed testing before they allow any hospital to do a test. And they have listed levels of lactic acid beyond which the test would not be reliable. But the results, based on this study of 600 multiple sclerosis patients, 2 big centers in Italy and 1 in the Netherlands, show that the highest level of lactic acid in the MS patients did not achieve, didn't get close. Usually patients with MS that are asymptomatic can have normal or low normal levels, or slightly elevated. It was the ones that had more symptoms that had elevated levels up to, I think the highest was 6.5 millimoles per deciliter, which is not high enough to interfere with our result.
Now, with respect to the lab at Good Samaritan Medical Center, the interference that you were speaking about earlier on cross-examination, what would happen if any of those types of interference were to occur during the course of the testing?
Objection.
No, I'll allow it.
The 3 main ones, which I detailed earlier, is the hemolysis, icterus, and lipemia. Machines are sophisticated. It will detect it and say, it will flag it and say, please do not result it, or we'll have a disclaimer saying, interpret this result with caution. The results may not be accurate. And it hardly ever happens with alcohol testing. But if it did, we would get a result like that, and we probably wouldn't report it.
And from your review of the defendant's medical records, specifically her testing from January 29th, did you notice any interference or any reports like that in her record?
No.
Now, the testing that you're doing at Good Samaritan is in relation to patients such as that might have cancer or heart disease or something like that, correct?
Correct.
Now, you were talking or started to speak on cross-examination about the good quality lab results that you have from your lab, and you wanted to go into that further. Could you please expound upon that for the jury now?
We have you mentioned proficiency testing before. So all hospital laboratories accredited by the CAP or have to participate in proficiency testing. What that means is that every 3 times a year, and they give us 5 unknown samples. And we have to test it, report it back to CAP, which also reports back to the government. And we have to basically get the correct answers. And with alcohol testing, it's probably one of the best tests in the laboratory. Always have right on the money results. But at the same time, we're also able to look at results of all the other labs that participated in this proficiency testing. So we can look at different methods. We can look at labs that have the same method as us to see how we're doing. And usually with this proficiency testing, we have 3,000 labs across the nation that have the same methodology as us, so we can compare to them. And also, interestingly, we can see the labs that are using headspace gas chromatography. And out of interest, we can see, how do we compare? And we have exactly the same results on these proficiency testings. We also look at some statistics as well, not going into them, but we can look at some stats like standard deviations and SDs. And actually, the hospitals with enzymatic testing have slightly better stats with that compared to Headspace. Pretty close, but a little bit better.
And doctor, from your review of the defendant's medical records and the blood testing in this case, was that done in conformity with the policies and protocols at Good Samaritan?
We have policies in place to be followed, and there's no reason not to think that somebody didn't follow policy.